Hello and welcome. Thank you very much for joining us. I'm Dr. Derrick DeSilva. My guest today is Dr. Carolyn DeLucia. She is from Hillsborough, New Jersey, and it's a pleasure of speaking with you today. And you're going to be talking at the conference on female intimate health.
Correct.
So you're an OB/GYN, so it makes sense. It makes sense that that's what you're talking about. But I know you've been doing so much work in this arena. I mean, how did your practice evolve into this?
Great question. And honestly, I think everyone should have a little piece of this in their practice because sexual health is so relevant to our everyday lives. People who can't be intimate with their partner with pain or inability to enjoy the moment, it's very important to get that under control. So a few years back, my personal journey, I had a young, strapping representative from a laser company walk in. He's strutting his stuff and thinking him so cute. And he was a very handsome guy. And he said, "I have a laser that rejuvenates the vagina." And I said, "Get out of my office and don't let the door hit you in the butt." And he said, "Oh, no, please, listen to me." And he humbled himself, and I listened, and he said that this device could improve a natural sense of lubrication when being intimate and would support the bladder neck and could improve urinary incontinence.
Well, that perked your attention.
I said, "Say
Okay,
what?
What?
Say what?"
Talk to me.
Exactly. So these machines can do that and more. And the entire area in medicine has become a main focus. At most conferences, there's a whole day dedicated to how this device can affect the vagina, how there are radio frequency devices, high FEM devices, which is high intensity focused electromagnetic energy to rebuild the pelvic floor musculature. There, we use regenerative methods, of course, platelet-rich plasma. Exosomes are being explored in this area. And the possibilities are endless and so desperately needed. So I jumped right in both feet and haven't looked back since.
I'm sure you haven't, but let's back up a little bit. What are some of the reasons that women experience all of these feelings, if you will?
Okay, well, it really begins after childbirth, and some women will not always deal with or feel like they're right back to normal. Before we have a baby, the vagina's a cylinder. After the baby, it's kind of a square where all four walls fall in a square fashion, so it loses its ability to cling and it may feel lax. So women complain of laxity. That laxity decreases sensation with intimacy. And that's a problem for a lot of couples. Obviously, you want to be able to enjoy that moment, and sometimes after childbirth, it's not the same. Then going through life, gravity, aging, as our collagen diminishes in our face, it diminishes in our vagina as well. And with that, there's lack of lubrication, there's lack of sensation, and then as our testosterone diminishes throughout our lives, between the ages of 40, 50, you know how drastically women's testosterone drops, and with that, women lose interest. So their libido can disappear. And with that, we have to replace their testosterone or somehow stimulate the tissues so that they're constantly being reminded they have that anatomy.
Right. Well, and I think that the whole idea of paying attention, and I think this is a very good point that you made in the beginning, was this is a conversation that a primary care physician like myself, an internist like myself, needs to be having with all of our patients, not only just leave this up to the gynecologist.
Correct.
And I think that's kind of the lesson that I have learned from you over the years, which is important. So What else do we have? We have the lasers. You mentioned PRP. You
Yes.
mentioned exosomes.
Yes.
Hormones, do they play a role?
100%. Absolutely. So you have to look at the entire person, what their symptoms of, what they are experiencing, what issues they're having being intimate, whether with themselves or with a partner, and what they want. What is it that they want to be able to feel? Do they want to be able to have an orgasm every time? Do they want to be able to have an orgasm with penetrating intercourse, just minimal clitoral stimulation? All of this has to come into play.
Yeah, but you can fine tune that to that level?
Oh, absolutely. Actual optimization, just like we do with everything in healthcare, especially in your integrative medicine practice. You're optimizing everyone's health, and you want to make sure their thyroid is primed, their vitamin D levels, their B12. It's the same thing. We prime the sexual organs to perform to their maximum degree.
And I think the other conversation that has to be had, which I'm sure you do with your patients, is what about the male piece? You know, the male piece obviously has to work also. You know, what are his hormones like?
Yes.
What is his testosterone like? Does he have
Yes.
erectile dysfunction?
Yes.
And there's a lot of moving pieces as we get older that
You have to treat the couple, and I will treat the male partners of my patients, or the female partners, but specifically now switching to the male, we want to optimize his erectile function and libido and interest. And so we check testosterone, the high fem chair, which is the high focused electromagnetic energy that rebuilds all the pelvic floor musculature to its maximum degree, helps with erectile function. It's the only non-invasive FDA approved device for urinary incontinence in men. And that is men waking up in the middle of the night, as an example, to use the restroom. They sit on this chair and they can sleep through the night.
Oh, wow.
Yeah. So that's a huge improvement in life. And as well, improving their sexual function by blood flow and muscle contractility.
So this chair, which we've all heard about, and I've heard about it specifically for women.
Correct.
So this is a chair that can also help with men?
100%.
I did not know that.
Yes, it's fantastic. So, and I tell you, the men who can sleep through the night, who I was giving this lecture out in California at one time, and this gentleman's nodding his head and nodding his head and nodding his head in the audience. And afterwards, he ran up to me. He goes, "It's so true. I used to wake up 4 times a night, and now I sleep through the night." Wow. And that's huge. Getting a good night's sleep,
Absolutely.
you know how important that is.
Absolutely.
And with our cortisol levels and the trickle effect of all that impact.
Heart disease, strokes, blood, I mean the whole
Everything.
deal, you know, high blood pressure.
Quality
it's just quality of life.
sleep.
And exactly. That's a great,
Yes.
great point.
Yes.
So what do you tell the physicians that are watching this video right now? What's your message?
Oh, my message is don't be shy. Speak to your patients about their intimate health. You don't have to say, how many times a week are you having sex? Just ask, how are things going in your intimate life? You don't have to say it any more than that. They know what you're talking about. And they'll say, oh, no, I'm past that. Well, when you hear that, you know there's a problem. And you want to be able to address that with your clients and speak to them asking specifically what's happening. Are you interested and can participate, your partner can't? Or is it vice versa? Or is it both? If they're on the same page, I saw a woman in her 60s the other day, and she said to me, I don't have much interest and it does hurt. He's having his issues. We've talked about it and we've decided that cuddling and external touch is enough for us for now. I'm not messing with that. I'm not going to invade. I'll just tell her, well, if that's ever not enough, please don't let your intimacy wane. Let me know and we can work on that. I want you to be aware that you shouldn't ignore these things. There are ways to treat and address each issue.
But that's a very healthy approach. That's a very healthy approach that they've even sat down and had that discussion and even gone through that whole thing together.
It must be that way.
Right.
It must be.
Right.
Because if they're not speaking,
right.
well, we don't even talk about it.
Yeah,
There's
that's
a
a problem.
problem.
That's a problem.
There's a problem. Because not speaking about it, you know one or the other is unhappy, feels slighted, and there is resentment breeding in that relationship, and you know what resentment leads to.
Right.
Divide.
Right. So I think the message I'm getting from you is have a conversation
Yes.
with your patients. If you're not comfortable, and this is what I tell my patients, and I've discussed this with my nursing staff, is when I have this discussion with a woman, as being a male, what I do is I bring one of my nurses in.
Yes.
Because sometimes it's a little uncomfortable for the women to be talking to a male, even though they know me. And I think the message is have one of your nurses come in. Have them come in while it's a very different discussion with you.
Oh, yes.
Right, with you and a woman.
Yes.
So that would be my piece of advice for you, physicians that are watching their males. Not sure how to approach this, but the bottom line here is talk to them.
Yes.
And try to get them into a better place.
That is
There are
correct.
options.
Yes.
And if people want to contact you for further information, what's the best way to get you?
You can always email me directly at V as in Victor I, V as in Victor A, GSOLV as in Victor at gmail.com.
Okay.
You could also go to my website, which is www.carolyndeluciamd.com, and you can also go get my free book. I'm not even charging for it. I'm desperate to get the word out to women that there are treatments available. So it's a cute little book that doctors can hand to their patients as a reference to shorten this discussion, because we have a lot
great idea.
to share. So the book is at www.ultimateintimacy.net.
www.ultimateintimacy.net. Dr. DeLucia, thank you. By the way, just an FYI, all my GYN, and well, not so much OB, right, but all my GYN goes to this young lady in New Jersey, because I'm also from New Jersey. So wonderful to have you here with us at
Thank
AMMG.
you so
Thank
much.
you for joining us.
Always an honor.
And I hope you enjoyed this. Thank you very much for joining me. I'm Dr. Derrick DeSilva. Until next time, may you always be blessed with good health.